Good afternoon to everyone and welcome to today's session. The NEET PG Bahubalis and the warriors and aspiring a big dream to be the topper in the upcoming NEET PG exam. I hope your preparation is all going well. I'm sorry I am late by about 1 hour. Few things delay our life and our plans. So why I'm saying that is, you also plan a big schedule, a tight schedule, but suddenly your girlfriend is depressed, she wants to be counseled, or your boyfriend is feeling sick, you need to help him out. The mama wants you to go for shopping. We are all adults, so that's the reason nothing is predictable. So, doctor, let's make the great beginning. And I wish you're all glued. I'm able to see a very good number of 25 participants. So, I'm surprised. YouTube is showing less participants, but the number of people who logged in are a lot. Is it because without YouTube also you can log in? Maybe. That's good and that's great. So let's make the great beginning. Doctor, are you all ready? I'm waiting for 5 more people. Please inform in your Telegram groups and everywhere that the quiz has started. Good. Yes, quiz started. Anesthesia. It's going to be relatively a shorter quiz because I had very little time to prepare the questions. But it's okay. Anesthesia is one subject. Too much of assimilation in too short a time can make us feel sick. Another 4 players I want to start. Almost 25 of you have logged in. Yes. Loudly tell your friends that the live session has started with Dr. Murali Bharadwaz. So every day, 5 shows, doctor. 11 a.m., 3 p.m., 7 p.m., 9 p.m. and midnight masala at 12 p.m. So at least every day you should revise 100 questions from 5 different subjects. Compete with your friends in a playful way. Identify where you are really strong, your friends are very strong, where you need to improve. You take coaching anyway, but you still require Murali Bharadwaz because I have no other job than to spend a very good time and a great time. So, doctor, let's make the great beginning. Yes. Regional cerebral metabolism is increased by. I have given a proper 15 seconds time for you to crack this. Yes. Boom, boom, boom. Punctuate answer. Excellent. Regional cerebral metabolism is increased by pain, not by anything else. Okay? So, all the remaining anesthetics don't have an effect. RDP is in the top. Harry, Basha, Tabassum, our anesthetic team. Al-Khami Naini also joined. Very good. Question number 2. What is a suitable anesthetic for the patients with a raised intracranial pressure? So, imagine that anesthetic, surgical gown, mask, saving scores of patients' life, always on your tenter hooks. It's a beautiful branch of medicine. General medicine, psychiatry, anesthesia, cardiology will never make you old because you are dynamically running around. So, very good. So, nitrous oxide, thiopentone, atracurium is a very good combination for the people with a raised intracranial tension, is what you need to remember. So, anesthesia is always subject of drug of choice, drug of choice, drug of choice. So, we have about 20 hours of lecture, excellent MCQ based discussion on the online mbbs.com video library. Take an opportunity to take a subscription. Very good. Question number 3. The second twin became stuck because of the administration of ergometrin. Now you need to relax the uterus. Which of these drugs you want to prefer tomorrow as an anesthetist doctor? So, I know Ritodrin will be your choice, but halothane is a good uterine relaxant in this kind of a scenario where the second twin becomes stuck after administration of the ergometrin is what you need to remember. Excellent. SR is on the top. Ishit, COVID, Al-Kaminini, Jofim. Excellent, doctor. I'm so happy to see a lot of new faces, new friends joining this quiz. For all the newcomers, I want to say every day 5 quizzes. 11 a.m., 3 p.m., 7 p.m., 9 p.m., 12 p.m. midnight masala. And if you become the winner, 40,000 rupees worth of online mbbs.com video library with 3,000 video lectures, 1 lakh PowerPoint slides, 30,000 MCQs topic-wise classified, 65 full-scale grant tests and discussions, NEET PG pattern. So all is going to be yours. So check how good you can and also bring more number of your friends into our consortium. Suxamethonium does not cross the placenta because it has got a high degree of ionization. That is the main reason it does not cross the placenta, is what you should appreciate. Shiva Shankari, Shivananda Lahari. Shiva Shankari is on the top. Very good. Question number 5. In the fetal transfer of the drugs given by the epidural route, what is a true statement? So all indications, contraindications, pathophysiology, everything of epidural anesthesia, you have to be 100% sure. So if you give by the epidural route, it can lead to fetal bradycardia may occur with the local analgesics, is what you have to appreciate. So epidurally you can give opioids, there is no contraindication. Al-Kaminini is on the top. Now, doctor, question number 6. Diazoxide is used in the treatment of preeclampsia. Why do you use diazoxide? What is the reason in preeclampsia? For all these reasons except God's great doctor, it causes diuresis. It is given intravenously. It causes hypotension. It prevents hypoglycemia. They're all true. But it does not increase uterine contractility, is what you need to remember. That makes Shiva Shankari and Bob really doing great. Even Min also. Kalai also. Very good. So just be part of our WhatsApp quiz group. Every time the quiz is about to start, We will put the quiz link. Just join it anywhere you are there on your smartphone. And along with the friends, 2-3 friends together also can be able to crack, because if you get to the top, you have a great chance of winning 40,000 rupees worth of online MBBS subscription. So every day 2 lakh rupees worth, virtually 5 shows we give over to the students, because knowledge is meant to be made available, affordable, accessible anywhere, anytime. That is the mission of onlinembbs.com. Question number 7. Pethidine is used in obstetrics. Why? Because of what? Yes. Pethidine is used in obstetrics. Why? I'm able to see some subtitles here. Are the online students also able to see the English subtitles? Then that is really great. Very good. So Pethidine is used in obstetrics because it does not affect the uterine contractility. That is the reason. Okay. So neither it relaxes and lead to PPH, nor it does not contract. So it won't affect. Min is on the top. Those who are on YouTube, please let me know whether you are able to see the English subtitles for what I am talking. Then I am really happy. Because we have students from Bangladesh, Middle East, Nepal, Philippines, across the globe. So, doctor, the next question, question number 8. What is wrong statement about Propofol? Propofol. Everything about, anything about Propofol, you got to be 100% sure, doctor. Yes. And the online students can be able to see the English subtitles YouTube is creating. I'm able to see, that's the reason. Please give a feedback. So, doctor, Propofol has a rapid, smooth induction. Please don't forget. Very important is PONV. PONV means post-operative nausea, vomiting. Propofol has an advantage that it has got a very low post-operative nausea, vomiting. Propofol also lead to rapid recovery, which is another important great advantage of the Propofol. But Propofol is painful on injection. That's what you should remember. So that keeps Min on the top. Jai Sri Krishna is also picking up. So we have Shankari, Lord Ishvara, Sri Krishna, Sri Mahavishnu is there. Only Brahma is missing, right? So very good. So Dr. Propofol advantages 1, 2, 3, 4. Tell me. Rapid, smooth induction. Number 2. You can titrate the depth of anesthesia very easily in a spontaneously ventilating patient by using a infusion pump of Propofol. That's the reason in all intensive care sedation protocols, Propofol is a very easy to use component. Suppose if somebody is on ventilator, he is fighting against ventilator, you want to sedate him, Propofol is often used. So Propofol is also called milk of amnesia. If you look at Propofol bottle, it looks so milky white. That's what you need to remember. And there's a rapid recovery with Propofol, low incidence of post-operative nausea and vomiting. But what are the disadvantages? You need an IV access. There's a pain on injection. And very few people, very few anesthetists in the world are really skilled on total intravenous anesthesia for a 3-year-old patient. There are few disadvantages of Propofol. Question number 9. The child may display a very agitated behavior for 5 to 10 minutes after recovery with which anesthetic? That's a very interesting question. He will display very agitated behavior for 5 minutes after recovery with which anesthetic? Whoa! Even other anesthetics can have a temptation, but sevoflurane. Actually, sevoflurane is very good in pediatric population. You can remember, sevoflurane is given to Sishu. Sishu bole to chota munna, little baby. So sevoflurane is the anesthetic of choice for the pediatric age group, no doubt. But sevoflurane after recovery from anesthesia can lead to agitated behavior for about 5 to 10 minutes. That's the point you need to appreciate. Good to see 36 online students. Very good. Please invite more and more of your classmates, doctor. Evening 7 p.m. tonight. Radiology. We will have a fight. I will try to set up a 30 MCQ. Mind-boggling, classical radiograph based questions, some of which will come in tomorrow's FMG NEET PG also. No surprise. Okay, so for past 20 years, Dr. Murali Bharadwaz had an opportunity to mentor and study along with almost 2 lakh medical students. The whole generation. There was nobody when I started the concept of coaching program in 1999, when I myself was preparing for entrance. So that's the reason, doctor, I know what examiner want. I will give you what examiner want from you. Only promise you need to do is come and play these 5 quiz tournaments every day. Click on that bell sign of YouTube subscription, be part of our WhatsApp group, and also share this to all your friends. So rapid, smooth induction, advantage of sevoflurane. Avoidance of IV access prior to anesthesia, no need, unlike Propofol. And it is easy to titrate the depth of anesthesia with end-tidal concentration. It is in fact more easier with sevoflurane than Propofol. Rapid recovery, cheaper than Propofol, but disadvantage, child may find the sevoflurane induction slightly irritating, unacceptable. There can be a 5 to 10 minute agitated period. But Propofol main advantage is there is no post-operative nausea vomiting, whereas sevoflurane has a higher PONV comparatively, is what you need to remember. Question number 10. Stellate ganglion block. If you see the last 10 question papers of AIMS and FMG, stellate ganglion block is sitting in the examiner's question bank. You have to master everything about it. Sure shot आने वाला question. देखो कितना लोग wrong किए हैं. So stellate ganglion block can lead to pneumothorax, dural puncture. There can be inadvertent injection to the vertebral artery. It can lead to damage to the vagus nerve, and it also can lead to damage to the phrenic nerve, not glossopharyngeal. That is what you need to appreciate. Excellent, doctor. Excellent. Min is on the top. Pseudomonas, Bob Al-Khamenei. Oh, Al-Khamenei missed it. So there is a damage to the phrenic nerve. Question number 11. Sympathectomy may be used in the treatment of all these conditions, except whoever answers this is ready for the game, doctor. Chalo dekhenge. Kaun banega NEET PG pati? Very important question. Yup. 7 of you are really ready to crack it. We use sympathectomy for Raynaud's disease, causalgia, hyperhidrosis, and whenever arterial ischemia is leading to intermittent claudication in a peripheral vascular disease. That is also an indication for sympathectomy, is what you need to remember. Good. Min is on the top. It looks like Min is going to win. Yes. Good to see 001. Hey, 001, are you able to see any English subtitles on the YouTube, or I am the only guy who is seeing that? Yeah. Now, question number 12. What is the method of measuring the halothane in an anesthetic breathing system? These are all the methods except. So how do you measure halothane in the anesthetic breathing system? Yes. Very good. 3 of you only are rightly answered. We use infrared spectrometry, ultraviolet spectrometry, mass spectrometry, but not gas chromatography. So that keeps Bob on the top. Wow, Bob. Jai Sri Krishna also correctly answered. Question number 13. Oh, no subtitles? All right. What is wrong about nitrous oxide? Nitrous oxide. Yes. Of course, there is an option to on the CC button. Yeah. So almost 39 online. I'm so happy. Yes, doctor. Typically, nitrous oxide has got a low blood gas partition coefficient. There is a second gas effect that will accelerate the onset of anesthesia of nitrous oxide. Nitrous oxide is a potent analgesic. And nitrous oxide is also good because fast onset, fast offset. Because it has a low blood gas partition coefficient, it has got a fast onset, fast offset. That is the point frequently asked by the examiner. Okay? Now, the next question. Oh, Min is on the top. Okay, on the laptop, the subtitles are coming, not on the smartphone. Very good. Just give me a feedback, 001. Can you be able to listen the, can you be able to toggle between YouTube for the voice and the Google Chrome for the playing of the quiz? Is it possible? You don't need 2 computers? I want to know from you guys, are you able to do that? In fact, YouTube, if you are a premium subscriber, the advantage is even when you are on the Google Chrome playing the game, still the YouTube voice can keep coming. That is an advantage. Yes. So, nitrous oxide is a potent analgesic. It's a carrier gas for volatile anesthetics. It has a low blood gas partition, so rapid onset, rapid offset. And if you are using nitrous oxide for induction of anesthesia in children, it is the second gas effect which will accelerate the onset of anesthesia. Yes, what you need to remember. Question number 14. This last 2 questions are going to decide the winner of 40,000 rupees. Bone marrow toxicity is a potential problem with which of these anesthetic agents? Bone marrow toxicity. Yay! 10 of you are right. Nitrous oxide. Prolonged exposure of nitrous oxide, especially those who are working. So Sushant is asking a very good question. Sir, when we are not able to solve any questions, we tend to get depressed. What to do, sir? भैया सुशांत, मेरे प्यारे भैया सुशांत, depression, anxiety, to feel jealous about somebody else, or to self-pity on ourselves. These are all the negative emotions, Sushant Viday, right? It's a simple equation. There are 30,000 points, 953 topics, high-yield topics in 19 subjects, 300 hours of your time to go through these list of 30,000 points. And already they are all there in the onlinemmbbs.com video library for you to revise n number of times. What's the problem in doing a revision? Simple. It's okay. First time we don't know bone marrow toxicity is caused by nitrous oxide. But abhi to samajh mein aa gaya na. Next time we forgot it was nitrous oxide which is causing bone marrow toxicity. Fir bhi, third time you will remember. Convert the depression, convert the anxiety, convert the self-pity into a positive emotion. Rise up, जिंदगी के सबसे बड़े चीज नहीं गिरने में नहीं, मगर गिरकर हर दफा उठने में है. Any number of blows on us, we should become more resilient with every blow that the life offers us. Because there is an opportunity in every adversity, doctor. And the life is a beautiful book for you to tell your grandchildren. Only when it is embedded with a lot of adversities and the way that you have overcome that to become something great and big. You look at any great man or any big man and any man with great merit and a honorable work he has done. You look at his back, you look at his background. There are scars of lashes on his back. There are the tough situations that he cried, but he overcome. That should be the spirit of every human being. Deal, doctor, deal. Very good. So no more depression. I am there ना, मुझे और कुछ भी काम नहीं है. आपके साथ रोज 5 quizzes खेलना और ताली बजाना, यही काम है मेरा. बीच बीच में जाके कुछ पेशेंट्स को देख के आते हैं. कभी कभी क्विज डिले होता है, फिर भी be part of our WhatsApp group, and the moment quiz starts, join it. Okay, doc? So Bob is on the top. So bone marrow toxicity is a potential problem. Nitrous oxide is what you need to remember. The last question, which is going to decide who is the winner. What is wrong statement about nitrous oxide? Come on. Who is going to take the 40,000 rupees today? Diffusion hypoxia is a problem. It is a cardiovascular depressant. It has an increased diffusion capacity compared to nitrogen, and it leads to emesis, not an anti-emetic. It is a disadvantage with nitrous oxide. It has an emetic effect, is what you need to emphatically remember. That makes Bob on the top. Even Bob lost the last question, doesn't matter. Bob, Jindabad, Bob, Jindabad, Bob, Jindabad. Bob, take a screenshot, send it to our helpline. You know the number, 9000868 And Dr. Murali Bharadwaz is all yours. To be your companion, you get the onlinemmbbs.com video library subscription. And very nice to see Commandant from Armed Forces Medical College, our prodigious student last year who cracked the top rank in NEET PG. Very good. Once more at 7 p.m., we will all play radiology. Till then, keep reading, keep reading, keep reading. That's the only way to become the winner in the NEET PG exam. Bye-bye.